Hey everyone, welcome to the human side of hospitals. I'm so glad you are here. And now on this channel, we don't just talk about medicine, we listen to real people, to patients, to doctors, nurses, caregivers, anyone who has an unforgettable hospital experience. The hospitals can be places of healing, hope, sometimes even heartbreak, and every story has something to teach us. That is why I'm starting this, just to give people a space to share, to be heard, and to remind us that behind every hospital wall are human beings with stories worth telling. Now, here's where you come in. So, if you've ever been a patient, if you've worked in a hospital, or if you've supported a loved one through their hospital journey, I would love to hear from you. And you can send me a short video, audio, just write your story down. Or if you would like to sit and chat with me, you can join me live on Zoom. And all you have to do is just fill the form in the description below, or you can send me an email. And it doesn't matter where you are from, who you are, or whatsoever. You are welcome wherever part of the world you come from. And before we dive in, don't forget to hit the subscribe button and turn the notification bell. Basically, not to miss these incredible voices from around the world. And a quick disclaimer before we start: these stories, their personal stories, shared with full consent, and we are here just to inspire, educate, and raise awareness. One thing is those who want to remain anonymous online, well, for the sake of confidentiality and privacy, altered some of their voices into AI voices. And note that even the advice shared in these videos or in these experiences, they are not a substitute for medical advice. Always remember this. And if you have health concerns, always speak to a qualified healthcare professional. All right, let's dive into today's story.
Look, I've been putting off writing this report for 6 weeks now. The administration keeps asking for it, and I keep finding excuses to delay. Truth is, I don't know how to explain what happened on February 3rd without sounding like I've lost my damn mind. But you want a report, so here it is. I'm Marcus Webb, been working emergency medicine for 12 years, 8 of them here at Riverside Regional. I've seen pretty much everything you can imagine. Car wrecks, shootings, overdoses, heart attacks, strokes. I've pronounced more people dead than I care to count, and I've pulled off a few saves that still surprise me. Point is, I thought I'd seen it all. I was wrong. The case I'm about to describe is why I requested a transfer to family practice. It's why I don't work nights anymore, why I don't take trauma cases, and why I've been seeing a therapist for the first time in my life. If that sounds dramatic, well, you'll understand by the end of this. It was a Friday night, February 3rd. I was on the overnight shift with Dr. Katie Brennan. She's our chief resident, sharp as hell, and she's seen enough trauma to know when something doesn't add up. Our trauma nurse that night was Jim Patterson, a 20-year veteran who's probably forgotten more about emergency medicine than most doctors learn. Around 11:45 at night, we got the call. Multi-vehicle accident on Interstate 80, high-speed collision with ejection. The paramedics were bringing in a 34-year-old male who'd been thrown from his vehicle when it rolled at an estimated 65 miles per hour. Now, ejection injuries are bad news, really bad news. The human body isn't designed to be launched out of a car at highway speeds and then meet pavement. We're talking massive internal bleeding, traumatic brain injury, multiple fractures. If they're even still alive when they get to us. The mortality rate for ejection injuries is something like 70%. So when the paramedics rolled this guy in at 11:51, I was expecting the worst. What I got instead was, well, I still don't know what the hell I got. The patient was conscious, alert, and talking. His name was David Morrison, and he was polite, cooperative, and seemed completely unfazed by the fact that he'd just been in what should have been a fatal accident. "Good evening, doctor," he said as we transferred him to the trauma table. "I appreciate you taking care of me." That was my first red flag. People who've just been in major car accidents don't usually sound like they're checking into a hotel. I started my primary survey. Airway, breathing, circulation. Everything looked good. Too good. His vital signs were rock solid. Blood pressure 118/76, heart rate 72, oxygen saturation 99% on room air. For someone who'd just been ejected from a vehicle, his vitals should have been all over the place. But here's where it gets weird. His clothes were absolutely destroyed. I'm talking shredded jeans, torn shirt, jacket that looked like it had been through a wood chipper. The kind of damage you'd expect from being dragged across asphalt at highway speeds. The problem was his skin underneath. It was perfect. Not a scratch, not a bruise, not even a scrape. I've been doing this for 12 years, and I've never seen anything like it. When you get ejected from a car, you get road rash, period. The asphalt takes skin off like a cheese grater. This guy looked like he'd put on destroyed clothes over completely unmarked skin. Mr. Morrison, I said, trying to keep my voice steady, I need to cut away your clothes so we can examine you properly. Of course, he said, whatever you need to do. Jim and I cut away his clothing, and with each piece we removed, the impossibility became more obvious. His jeans weren't just torn, they were shredded, fabric missing entirely in some places. But the skin underneath was smooth, unmarked, with normal coloration. No abrasions, no contusions, no evidence of trauma whatsoever. Doctor, Jim whispered to me, this doesn't make sense. He was right. It didn't make sense. In 12 years of emergency medicine, I'd never seen anything like this. When someone gets ejected from a vehicle at 65 miles per hour and lands on asphalt, they bleed. They always bleed. This guy hadn't lost a single drop. I continued my examination, checking for internal injuries, head trauma, fractures, anything that would explain how someone could survive this kind of accident. Every test came back normal. His neurological exam was perfect. His abdomen was soft and non-tender. His extremities showed full range of motion with no evidence of fracture. Mr. Morrison, I said, can you tell me exactly what you remember about the accident? Certainly, he replied. I was driving westbound on Interstate 80 when a truck ran a red light and hit my vehicle. My car rolled several times, and I was thrown clear. I remember hitting the ground, and then the paramedics were there. It was a straightforward account, delivered in a calm, matter-of-fact tone that didn't match the severity of what he was describing. Are you experiencing any pain anywhere? I asked. No pain at all, doctor. I feel fine. That was impossible. Even if he'd somehow escaped serious injury, he should have been experiencing pain from minor trauma, soreness from the impact, something. But he reported no discomfort whatsoever. I ordered a full trauma workup, CT scan of the head, chest, abdomen, and pelvis, X-rays of the cervical spine, chest, and pelvis, complete blood count, comprehensive metabolic panel, arterial blood gas, coagulation studies, urinalysis, and a toxicology screen. While we waited for results, I stepped out of the trauma bay to discuss the case with Dr. Brennan. Katie, what do you make of this? She shook her head. Marcus, I've never seen anything like it. The mechanism of injury says he should be dead or dying. His clothes say he took massive trauma, but clinically, he's completely normal. Too normal, I said. His vitals are better than mine right now. The test results started coming back around 1:15 in the morning. Every single one was normal. His blood work looked like that of a healthy 34-year-old who just had a routine physical. His CT scans showed no evidence of traumatic injury, no bleeding, no fractures, no organ damage. His X-rays were perfect. This is impossible, Katie said, reviewing the results. These aren't the results of someone who was just ejected from a car. I know, I said, but here they are. I went back to examine Mr. Morrison again. He was sitting up in bed, alert and comfortable, looking like someone who'd come to the emergency room for a minor complaint. Mr. Morrison, all of your tests look good, which is unusual given what you've been through. I heal quickly, he said with a slight smile. What do you mean by that? Just that I've always been fortunate when it comes to injuries. They tend to resolve faster than expected. It was an odd thing to say, but I pressed on. Have you ever been in a serious accident before? A few, he said, but I've been lucky. What kind of work do you do? I'm in risk assessment, he replied. I evaluate dangerous situations for insurance companies. That would explain why he seemed so calm about the accident, but it didn't explain his complete lack of injuries. Around 2:30 in the morning, I decided to call Dr. Patricia Hughes, our trauma surgery attending, for a consultation. Patricia has been doing trauma surgery for 15 years and has seen cases from all over Northern California. If anyone could make sense of this, it would be her. Patricia arrived 20 minutes later and went through her own examination of Mr. Morrison. Her findings were identical to mine. A completely normal physical exam in a patient who should have been critically injured or dead. Marcus, she said after completing her assessment, in 15 years of trauma surgery, I've never seen anything like this. The mechanism of injury is incompatible with his clinical presentation. So what do we do? Medically, there's nothing to do. He's stable, he's not injured, and he's not complaining of any symptoms. But I'd like to keep him for observation. We admitted Mr. Morrison to the trauma intensive care unit for a 24-hour observation period. He was cooperative and pleasant, though I noticed he didn't seem particularly interested in contacting family or friends. When I asked about next of kin, he said he preferred not to worry anyone unnecessarily. The next morning, Saturday, February 4th, I checked on him before leaving my shift. He looked exactly the same, completely normal, showing no effects from his supposed ordeal. How are you feeling this morning, Mr. Morrison? Excellent, doctor. Thank you for taking such good care of me. Do you have any questions about what happened last night? He looked at me with an expression I couldn't quite read. Doctor, in your experience, how often do you see cases that challenge your understanding of medicine? It was an unusual question, and something about the way he asked it made me uncomfortable. Occasionally, I said, medicine is still learning about the human body. Indeed, he said, the human body is capable of remarkable things that science doesn't yet understand. There was something in his tone that suggested he was talking about more than just his own case, but I couldn't put my finger on what it was. I went home that morning feeling unsettled in a way I'd never experienced after a shift. The case didn't make medical sense, and Mr. Morrison's behavior, while not overtly strange, felt somehow off. On Sunday morning, I got a call from Dr. Hughes. Marcus, Morrison is gone. What do you mean gone? I mean he's not here. Sometime between midnight and 6 in the morning, he left the hospital. No one saw him go. He didn't sign out against medical advice. He just disappeared. I drove back to the hospital to see for myself. The bed in the trauma intensive care unit was empty, freshly made as if no one had ever been there. Mr. Morrison's belongings, which had consisted only of his destroyed clothes, were gone. What did security say? I asked. That's the strange part, Patricia replied. They reviewed the footage from the hallways and exits, but they can't find any record of him leaving. It's like he just vanished. We contacted hospital administration and the police. Detective Maria Santos took the case and launched an investigation, but it yielded nothing useful. The security footage showed normal hospital activity, but no sign of Mr. Morrison leaving his room or moving through the corridors. This is highly unusual, Detective Santos told me. People don't just disappear from hospitals without leaving some kind of trace. The detective also investigated the original accident scene. Her report was troubling. The vehicle Morrison had allegedly been driving was found, and it had indeed rolled multiple times at high speed. The damage was consistent with a fatal ejection injury, but there was no blood evidence at the scene, no tissue, no signs that a human body had made contact with the asphalt. The accident definitely happened, Detective Santos explained, but there's no physical evidence that anyone was actually ejected from the vehicle. Over the following weeks, I couldn't stop thinking about the case. I started doing research, looking for similar incidents in medical literature and news reports. What I found made me question everything I thought I knew about my profession. There had been at least 8 similar cases reported at trauma centers across the western United States over the past 3 years. The details varied, but the pattern was consistent. Patients with mechanisms of injury that should have been fatal, presenting with no actual trauma, recovery that defied medical explanation, and subsequent disappearance from the hospital. In each case, security footage was either corrupted or somehow failed to capture the patient's departure. In In each case, the medical staff described the patient as unusually calm and intelligent, often displaying knowledge that seemed inconsistent with their supposed circumstances. Most disturbing was the effect these cases had on the medical professionals involved. Several doctors had reported persistent anxiety and difficulty sleeping after their encounters with these patients. 2 emergency physicians and 1 trauma surgeon had left their positions, citing burnout. I began to wonder if I was experiencing something similar. The case had affected me more than any other in my career, and I was starting to have serious doubts about continuing in emergency medicine. The final straw came 3 weeks later. I was working another night shift when our triage nurse called me into the waiting room. "Dr. Webb, there's a patient here asking for you specifically. What's the complaint? He says he doesn't have a medical emergency. He just wants to thank you for the care you provided." My blood went cold. I walked to the waiting room, and there he was, David Morrison, wearing different clothes but unmistakably the same person. He was sitting calmly in one of the chairs, reading a magazine as if he were waiting for a routine appointment. When he saw me, he smiled and stood up. "Dr. Webb, how good to see you again. I hope you've been well. What are you doing here? I wanted to thank you for your excellent care. It's not often that I encounter someone so thorough in their medical assessment. You need to leave, now. Of course. I just wanted you to know that your diligence in investigating my case was noted and appreciated. Not everyone would have been so curious about the inconsistencies. The implication was clear. He knew I had been researching similar cases. He knew I had been trying to understand what had happened that night. Who are you? I asked. I think you already know the answer to that question, Doctor. Or at least you know that I'm not what I appeared to be that night. He turned and walked toward the exit, then paused and looked back at me. You might want to consider a change of scenery, Dr. Webb. Emergency medicine can be very demanding, especially when you encounter cases that challenge your understanding of human physiology. Sometimes it's better to practice medicine that deals with more conventional problems. He left the hospital, and I never saw him again. But his message was unmistakable. He knew who I was, where I worked, and how his case had affected me. I submitted my transfer request the next day and moved to family practice the following month. I now treat routine problems: diabetes, hypertension, routine infections. I don't work nights, I don't take trauma cases, and I sleep with my doors locked. I've never told anyone the complete story because I don't think anyone would believe me. More importantly, I don't want to attract attention from whoever or whatever David Morrison was. I still think about the case regularly. I wonder how many other doctors have encountered similar patients, and what would happen if someone investigated more thoroughly. Most of all, I wonder if Morrison was right, that some things are beyond medical understanding, and sometimes it's better not to ask questions about the mysteries we encounter. I'm a good family practice doctor. I help people with problems I can understand and treat. But I'll never work emergency medicine again, because somewhere out there, something exists that can survive being ejected from a car at 65 miles per hour without losing a single drop of blood. And whatever that something is, it knows that I know.
Yeah.